Our guest today is Dr. Jeanne Bouteaud. She is a gynecologist obstetrician at the University of Montreal Health Centre, and she holds a dual fellowship in quality improvement and menopause. It's an honor to have her here with us today. We're going to discuss genitourinary syndrome in menopausal women. So, I'd like to begin with an overview of the symptoms and the causes of genitourinary syndrome in postmenopausal women.
We know that menopausal women experience a drop in hormones once they enter menopause. This includes estrogen, testosterone, and progesterone. We also know the tissues in the vulva, vagina, and bladder are all extremely sensitive to these hormones. So, when these hormones decrease during menopause, we see that the tissues of the vulva, vagina, basically of the whole genitourinary area, are affected by this decrease in hormones. This leads to what is historically known as atrophy. The tissue gets thinner, smaller, and will become stiffer, drier, and more fragile.
So, how will this manifest?
So, it really affects the whole genitourinary sphere. You will see symptoms of a urinary nature, like recurrent urinary tract infections, dysuria, which is a burning sensation during urination. There can be urinary urgency. There will be a whole sphere of urinary symptoms. Then, there are the genital symptoms. These can include dryness, itching, irritation. Some women will even experience bleeding, which can be associated with atrophy. Then, there is the whole sphere of symptoms which are related to sexual function. This means a decrease in lubrication and potential discomfort during sexual relations. So, we are really concerned with the whole area.
Do you think that, without treatment, it gets harder to manage?
Absolutely. What we've seen is that some patients have avoided the subject for a long time, or, for whatever reason, have had trouble finding someone to consult with and take care of this problem. Then they tell us, if I had known, I would have done something about it sooner. So, yes, of course, as the syndrome progresses and intensifies, it gets harder to treat. We can often see some improvement, but rarely do we see a total return to the stage before menopause. However, if it is taken care of early, we can slow it down or even halt it completely. So, the earlier you address this issue, the better it is.
Do you get the sense, when seeing your patients, that it goes beyond just the genitourinary symptoms, that it has an impact on their daily lives and on their intimate relationships?
Absolutely. Studies show that genitourinary syndrome can impact a patient's quality of life in the same way that COPD, asthma, or other chronic diseases can.
Dr. Bouteaud, aside from the symptoms patients show, how can you diagnose genitourinary atrophy linked to genitourinary syndrome in menopausal women?
Usually, the symptoms described by the patient give us a fairly obvious clue. These are very classic symptoms. It is also very common to have patients who complain about fungal or yeast infections. They use over-the-counter creams, it recedes for a few days, then it comes back. It's very, very rare for menopausal women without a particular medical condition, just as it is with prepubescent women, to have fungal or yeast infections in the vulvar area. So, in these cases, we start to think that there must be another cause. We recommend at least one vulvar and vaginal examination to rule out any other pathologies that might require treatment. If this examination doesn't reveal any other obvious signs of disease, a diagnosis of menopausal genitourinary syndrome will be given.
Once the diagnosis has been made, what is your therapeutic approach?
So, at this stage, we will look at ways for the patient to make changes in her lifestyle. To begin with, we know that women who have regular sexual relations show fewer symptoms. So, we know that the act of stimulating the region and of having sex will improve blood flow to the region, which is important in maintaining the tissue's elasticity. So, there is some truth to the old saying, use it or lose it. But of course, we're not telling patients who feel pain and show symptoms that they need to force themselves to have sex. That's not what we're saying at all. We also know that irritants must be avoided as much as possible. The vulvar and vaginal skin is extremely fragile, it gets thinner, it becomes very delicate, and it can be more susceptible to all kinds of irritation. So, we try to look for all natural products that are readily available. The fact remains that the vulva is skin, and skin needs to be moisturized. You can use coconut oil or olive oil to moisturize the exterior region of the vulva. You can also find some moisturizers that are available over the counter without a prescription. These moisturizers should be used regularly. They are not sexual lubricants. They are designed to be used 2 to 3 times per week continuously to maintain moisture levels in the vulva and vagina. This will relieve discomfort, itching, and pain during sex for some patients. Studies show that moisturizers with hyaluronic acid yield better results for these patients compared to products without it. So, when choosing a product, begin by asking for one that contains hyaluronic acid. When it comes to sexual relations, we know that menopausal women are less capable of lubricating naturally. This is normal. So, we need to make up for this lack by using a lubricant. Once again, there are all kinds of lubricants available in pharmacies and online, and you need to choose carefully. As I mentioned, the skin has become very thin. Since it's extremely fragile, you need to choose a product that contains the least amount of irritants possible. Common irritants found in lubricants include parabens. There may be some products preservatives or other irritants. Also, if you decide to go for lubricants that are water-based, you need to look for osmolality, so that's a feature water-based products. This information is sometimes hard to find. You may need to look for it on the company's website. It's not always easy, but a product with inadequate osmolality can cause burns and even more symptoms when you use it. An alternative to water-based lubricants are silicone-based lubricants, which have been shown to be superior for breast cancer survivors. Silicone-based lubricants are rarely found in drugstores, but you can order them online.
In the previous segment, we discussed the conservative treatments available for genitourinary syndrome in menopausal women. Let's talk now about the medical treatments that exist. Could you elaborate across the entire panoply of new and previously existing treatments that are available on the market today?
Yes, we're very lucky. There are several new products to treat menopausal genitourinary syndrome that came to market in 2022. So, our toolbox has been greatly expanded in the past year. These are products that require a medical prescription. And among these products, we have a category that's been available for several years now, which is estrogen delivery by vaginal route. So, this treatment is offered as intravaginal tablets or in the form of creams, which can be applied to the vaginal and vulvar areas or as vaginal rings. In this case, a ring is placed inside the vagina and is kept in place there for 3 months. This product is made to be applied locally and can also be taken when hormones are delivered systemically. So even if you're already taking hormones through your skin or through your mouth, it is possible to also take estrogen vaginally. It's not superfluous or dangerous to use both in some cases, it's necessary. If you smoke, no matter your age, if you've had breast cancer, which we'll come back to, or if you've had blood clots, none of that prevents you from using these locally administered products in the vulvar or vaginal regions. I also want to mention that the information sheets for these products include a warning. This warning is put on all products that contain estrogen, regardless of the dosage. So this warning says that estrogens can increase the risk of breast cancer, of blood clots, and of strokes. This doesn't apply at all to locally administered vaginal products. So it's really a warning that's imposed on all products regardless of the dose. All studies have shown that it absolutely does not apply to products used locally in the vulvar and vaginal regions.
You have just reassured a large proportion of women by mentioning that.
Great, I'm glad. So, in our toolbox, we also have prosterone, which is made of DHEA. When administered vaginally, this molecule transforms into testosterone and estrogen locally in the cells of the vulva and vagina. Studies have shown that this product is also very good for treating menopausal genitourinary syndrome. There are currently no contraindications for this product for women who've had breast cancer. Then there's also a new and completely different tool, which is ospemifene. This is a product that is taken orally to treat menopausal genitourinary syndrome. And it's quite unlike anything I've mentioned so far, because it's delivered orally instead of locally.
Aside from medical treatments, there is a whole area of concern pertaining to the treatment of psychological issues. And even beyond that, issues with vaginal discharge or with regard to fasciae and muscles. So, what can you recommend for patients who, despite medical treatment, are still experiencing certain difficulties?
Some women will undoubtedly experience a more severe case of genitourinary syndrome. Often, what we see with these patients is that it's not just menopausal genitourinary syndrome. There's also pelvic floor dysfunction. So for these women, I really recommend a multifaceted approach. They may have to do some work in sexology in order to rebuild a healthy foundation while also working on tissue quality and on relaxing the muscles of the pelvic floor. So, sometimes treatment involves a more global or holistic intervention, not just local treatments.
Once we begin a hormonal treatment, do you think that this is something that can be used over the long term?
Yes. What we've found, and as I mentioned earlier, about treatments that are safe on a very long-term basis, is that they can lead to a decrease of up to 50% in the frequency of urinary infections. So, this is a treatment that can be prescribed to older women and extended for their entire lives, or as long as is required.
Dr. Bouteaud, thank you very much for talking to us about genitourinary syndrome in menopausal women. I'll see you in the next segment about breast cancer survivors with genitourinary syndrome.
Thank you very much.